name is Sally Gray, and I am Chairman of the Board of Directors for UnityPoint Health St. Luke's. Thanks to all of you for being here today. This is exciting. It's exciting for our community, for our UnityPoint region, and especially for our patients, both current and future. As you learned from the video, we are now a member of the Mayo Clinic Care Network, the MCCN, and we are truly honored to have been selected. We're the first hospital in the state of Iowa to complete the rather rigorous review process, which began for us almost a year ago. The selection process examined our overall operations, our quality, our service, and our culture. So needless to say, this is a really proud day. But what does this really mean? This means at the most basic level, if needed, our physicians and caregivers have access to Mayo Clinic expertise. We have access to Mayo Clinic physicians, specialists, their treatments, and their protocols. It means Mayo Clinic expertise right here at home. It means more patients with highly complicated medical issues can be treated and cared for right here at home. As they stated in the video, patients can now avoid unnecessary travel for answers to complex medical questions. More patients will stay within our community for their medical treatments, and that's just good for everyone, especially the patients. It means, if necessary, that we will now have 2 highly qualified, highly talented teams working in collaboration on patient-centered care. And, as you learned from the video, this is at no additional cost to the patient. It means Mayo Clinic peace of mind can now be ours right here at home. So this is a really big day for our community, and especially for the patients and the families we serve. Thanks again for being here. I would now like to introduce Dr. Todd Langager. Dr. Langager is a cardiologist with UnityPoint Clinic and all-around physician champion. Thank you.
Thank you, Sally, and good morning, everybody. I am one of the 2 physician champions that has been part of this process. I'm also a cardiologist, and I've been practicing in this community for over 20 years. And as I told some of my physician colleagues this morning, and anybody else who will listen, I'm very proud of the quality of care that we deliver in this community now. However, any physician at times has very complex patients, chronic conditions, or very rare conditions. And we, in situations like that, we need assistance in managing and caring for these patients. By being a member of the Mayo Clinic Care Network, we now have access to leading specialists in the world. And it's not just access, it's easy and quick access, where we can upload and provide copies of the diagnostic studies that we have performed on our patients, narratives, and they will review that, and within 2 to 3 days we get an answer. That is very quick response, much faster than the patient actually having to drive up to the Mayo Clinic. As the other speakers have talked about, the real benefits to the patients are severalfold. And as a physician, we want our patients to benefit from this. We certainly do as physicians, but our patients are really going to benefit, and in several ways. One, the majority of time, the patients are going to be able to stay in the community and get their care. Number 2, this consultation, if you will, one of the features of the Mayo Clinic Care Network, will be an actual part of their medical record. Number 2, or the next one, is that there is, as emphasized, no cost to the patient. So they receive multiple benefits from that form of interaction. That's not the only advantage of being in this network. As a physician and a provider, we also have access to literally hundreds of medical conditions where we can very quickly access diagnostic and treatment algorithms to help us at the time that we're actually seeing the patient. We can do this in the exam room, and we can show the patient that what we're doing is consistent with what physicians at the Mayo Clinic are doing, and that we're doing a good job for them. So that's an additive benefit not only to the patient, but certainly to the physician. We have other potential benefits as physicians. We have access to specific continuing medical education through the network. We have access to symposium and conferences, And I think another really nice feature, we have access to over 2,500 patient education materials that we can share with our patients. So those are just some of the very brief advantages to the patients and the physicians. I'm personally very excited about the opportunity to develop this meaningful collaboration with the Mayo Clinic, which in my opinion and in most others is one of the premier quaternary centers in the country and likely the world. This adds and builds on the high quality of care that we're delivering in this community. So with that, I would like to introduce Dr. David Hayes. He's the medical director of the Mayo Clinic Care Network and a fellow cardiologist.
Thanks very much, Todd. First and foremost, on behalf of Dr. John Noseworthy, who is our CEO and president, and the board and the whole Mayo family, we are even more excited to be here today and to have Cedar Rapids UnityPoint announced as part of the network. And in fact, timed with this conference, about 30 minutes ago, our lead story on our intranet was about this announcement, and also an email flash went out to all 60,000 or so employees. Just before we started, I got a note back from one of my colleagues in Arizona who prides himself on being at Mayo, prides himself on what he does, but most importantly, prides himself on being from Iowa. And in his note, he said, finally, a site in Iowa, thumbs up emoticon. So people are very excited. So we started this about, our first site came on board 2.5 years ago publicly. Why did we do this? Because we see healthcare changing. We think that it's important in the change across the U.S. that regional, healthy, quality healthcare organizations remain independent. We see this as a way that we can work with regional organizations and extend knowledge and expertise, given the growing number of electronic platforms that can be used, that true to our mantra, which is the needs of the patient come first, is best for patients. If patients can stay in Cedar Rapids or the area, and if remote extension of knowledge and expertise can help keep them in the area, they don't have to leave, they don't have to travel, it's good for your organization. We think that that's best for everybody all the way around. There are a lot of things that are included as part of this, and those will be talked about later. The only other comment that I would like to make is that we've had discussions with Ted and his team now for a year or so leading up to this. As we go through this process, the organization goes through a very lengthy and deep due diligence process. We request a lot of information from the organization to look at quality and safety and a number of other standards, so that we know that all of the members that are joining the network all carry the same level of quality and a similar philosophy in terms of being patient-centric. And so we appreciate the time and effort from all of the team here leading up to this. We look forward to this relationship getting stronger and deeper in years to come. And again, on behalf of the entire Mayo family, thank you very much.
I've been asked to introduce our next speaker, who is Mr. Tom Newton, Vice President of Network Engagement for Wellmark Blue Cross Blue Shield. Tom?
Good morning. First off, I'd like to say thank you to Ted and St. Luke's for inviting Wellmark to be a part of this announcement. When we start to look at our data, we realize that about $550 million worth of care delivered to Wellmark members occurs out of state. And of that $550 million, about $80 million occurs to, or is delivered to members who live really in the Cedar Rapids corridor. So as we look at an opportunity to capture some of that care, not all of it, certainly some of that care back into the local community. As we start to look at this, four themes really come to mind. The first of which is quality, the second of which is security, third, economics, and then finally, innovation. This is really a phenomenal opportunity for patients living in Cedar Rapids and the surrounding area to get the same level of care that they've come to know from their local physicians, but still having an opportunity to get a second opinion, from the Mayo Clinic when it's appropriate. Secondly, this type of arrangement provides the security and the peace of mind to those patients who otherwise may have had to travel, sometimes up to 250 miles to an out-of-state facility to really get that second opinion. To have that care delivered at the local level while at the same time getting the second opinion that gives them the peace of mind that they need to feel confident in the services that they're getting. Finally, when you look at it from that perspective, the security, also the quality, finally, the economics of it makes sense. As I mentioned, $80 million worth of care is going to out-of-state providers from this area. And if we have the opportunity to capture some of that care, it's better economics for the community, it's better economics for the patient, and it's better economics for employers that have employees living in this community. And finally, innovation, and this is probably one of the most important. This is definitely a sign of innovation, and I have to commend Ted and the St. Luke's board for creating this type of arrangement and really working and doing the due diligence to become a part of the Mayo Network. This is the type of innovative solution that we all should be looking for to try and improve quality and to contain healthcare costs. So again, congratulations to Ted and congratulations to St. Luke's.
Well, thank you, Tom, and actually thank you to Sally and Todd and Dr. Hayes. We are honored to be here today, obviously, and we think this is an innovation. We think this is the kind of collaboration that can make a difference, not just for us at St. Luke's, but for our entire community, and maybe even beyond that, because we are going to be watched about how we do this and how well it works. And we think that is a great opportunity for us. I want to make sure that everybody knows what this is not. This isn't a merger or an affiliation. We are UnityPoint, and we are UnityPoint Cedar Rapids. This is a collaboration between two of the best healthcare organizations in the country, deciding that we can still get better by working together. That sense of collaboration, that sense of being willing to tap the best of both worlds and to take the extra step for our patients is what this is about. And so we're looking forward to being able to do that. It's about what the patient needs first. But it's also about having that need met in the physician-to-physician interaction that is crucial to the patient. There are no extra steps for the patient here. There are no additional costs for the patient here. We're going to absorb that cost because we think we're going to reap the benefits of offering a better value to our patients and then saving those dollars for them, we think ultimately will mean more people will choose us to get their health care. That's how we will win. So focus on the patient needs first, focus on that physician-to-physician relationship, while recognizing that health care costs too much in this country, and we need to do more to help reduce the cost overall and to those individuals that we take care of every day. Now, for anybody who says, wow, all that information is going to be moving back and forth, is that going to make any vulnerability? The answer to that is no. This is all secure information. This will be part of the electronic medical record. We will be protected, so there will be no risk. This is just upside to our patients. It's so much about upside that the first year, our foundation asked to fund this. So the St. Luke's Foundation will fund the first year of this endeavor because they want to be seen as supporting the kind of innovation they believe this represents. I think that's amazing. What a vote of confidence in us. What a vote of confidence that this is what this community needs to do. So we are thrilled to be going down this way, to be setting a new path, breaking trail for UnityPoint, for Iowa, and to be joining, among other members of the Care Network, with what we believe is a group of the best providers in the world. We thought we were, now we know we are, and we're just going to keep going. Thank you for coming today.